So, any of you have any allergy problems or anything like that? I was trying to clear my throat a second ago. Yeah, I do. And right now, from everything I'm hearing, we're suffering through one of the worst pollen seasons that we've had in a long time. It just wipes me out, and and I look outside and I think how beautiful everything is here, and I think there's all this pollen in the air. I don't know if I really want to go out there. But despite that, I love living in Portland. I love where we live. I think we have the best of everything here, and I've been around enough places around the country to really get a sense of that. I think we have the best of everything, particularly here in the Willamette Valley. I think it's like just a fabulous place to be. I've read that Portland has more restaurants per capita, that is according to our population, than any other city in the country. Did you know that? Think about it. Think of all the restaurants we have popping up in the Pearl and everything else. It's amazing. And the reason why is, I think, because I hear that New York sous chefs and all that look for a place that they want to move to. They open their own restaurant and they move to Portland because we have that reputation of liking to eat food. And that makes sense because it rains enough here that all we have time to do is eat food, right? I also heard on the Food Channel that we are considered the food cart capital of the world. Now, that's another thing I believe, because you go downtown and you see all these food carts. It's amazing. When my kids want to get together with their friends, they say, okay, we're going to go down and hit the food carts at Portland State, or we're going to go hit the ones down by the Governor Hotel or all that, because they know where the food carts are. They know they're going to all get to choose their own meals at a really good price, and it's going to be a good deal. Last year, my son's best friend Grant, was getting very tired of his job, and he had a good engineering job, but he was just really sick of going to work every day and just sick of doing the work that he was doing. And so he quit his job. He took some of the family savings and went out and bought an old FedEx truck. It looked just like this. This is not the actual truck itself, but it looked just identical to that. The thing would hardly run, but he managed to coax it over to our house, where it sat in front of my house for weeks. Okay, well, my son, who really loves to work on cars, changed out the engine. He put a Cummins diesel engine in it. He completely rebuilt the drive shaft and the rear end, and even had to weld the gas pedal and clutch and everything together. And then after everything was through, as far as the mechanical part of it, he air conditioned it, and he wired it for electrical, and they put shelves and sinks and everything in it that they needed to operate this thing. Then they polished it to a shine, and this is what it looks like today. That's an actual picture of it. And they opened a Hawaiian Ono Shave Ice truck. They opened at the Rose Festival Fun Center. They had people lined up 12 deep to buy shave ice, because this is the real stuff, like you get in Waikiki. This is the fluffy, snowy stuff, with all the flavors, ice cream in the bottom, what they call these sweet mochi bits that they can sprinkle on top, and it's really the good stuff. They have been so busy. Okay, they're just getting ready to open up for the season. They're completely booked for the entire season, and it's really something that's worked out. And the neatest thing for Grant is that after he had finished the season at doing this, he got a call from his old company, and they said, "Can you come back up for work for us on a part-time basis?" Which he said, "Okay, as long as I can call the hours." He went back, and now he really loves his work again because he's doing something else. Isn't that funny? So here's my first recommendation for making ends meet in these tough economic times. If you need a few more bucks, open a food cart. It worked for Grant. It's something I, of course, don't want to do. So let's move on here. Let's talk about the calendar of provisions. What's currently in effect? And once again, I'm not going to go through any of these items in real detail. I'm going to point out a few things about it. Some of the things I'm going to add a little bit of information about, because I think it may be necessary for you. The small employer tax credit, we're going to talk about a little bit, but that's a tax credit for premiums paid by small employers. It's a very limited tax credit. It's to help small employers pay premiums on behalf of their employees, provide health coverage for them. Child coverage to age 26, I think most of you have heard about this. Have to cover children to age 26, but there's been some clarifications regarding that particular requirement. No rescission or coverage except for fraud. In the old days, if somebody was enrolled in your plan incorrectly for whatever reason, you could almost go back and retroactively terminate them with an unlimited time period. You go back a year and terminate them, in which case the insurance company would go back and they'd go to the doctors and they'd recover all of the benefits that had been paid for this person that should never have been enrolled in your plan. Now you cannot do that. Even if, due to mistake or whoever it is, you were misled into thinking this person was eligible. The only exception to this is for fraud. If the employee defrauded you, gave you some false information, then you can go back and do a retroactive termination of coverage. Lifetime and annual dollar limits are prohibited, although restricted annual limits are permitted for grandfathered plans until 2014. We're not even going to worry about that right now because 2014 is just around the corner. When 2014 hits, all lifetime and annual limits are going to be eliminated. Now, the one thing I want you to think about as you're starting to look at your renewals and everything for next year is what is going to impact your premium? What is going to cause your premiums to increase? Now, in the past, the premiums were based in part upon the ability of the insurance company to say, okay, we're not going to pay more than $1 million in benefits for you during your lifetime, or X number of benefits for you during a year, or $2 million, whatever it was. They can't do that anymore. That increases the insurance company's exposure. The only option they're going to have is to increase premiums. Now, it's probably not right for us to talk about it, but Dina and I were talking about a common friend that we have with one of the major health insurance companies, and they have just filed for a premium increase of 58%, I think, is that right? For individual health plans, which I have my son Adam on an individual health plan, and I heard that and I just about swallowed my tongue, okay? Because it's already kind of a high premium he's paying. So that's the kind of things that you can see how that's going to impact premiums. The prohibition against reimbursement for over-the-counter drugs and medicines without prescriptions. Previously, your health FSA could reimburse your employees if they bought things like aspirin or anything else over the counter. Cannot do that now unless they have a prescription to do that. Choice of providers. This simply means that any participants in a plan have a choice of primary care physicians who are available to be primary care physicians who are then taking on new patients. Emergency care coverage, the same as in-network without pre-authorization. What this means is that under the old plans, the insurance company or the health plan could say, look, we're going to pay the most favorable benefits for you if you go to a specific chain of hospitals or specific providers. But if you go outside of that, if there's somebody that we don't have these agreements with to limit the charges they're going to make to us, then we are going to charge you more. And what the Affordable Care Act says is that you cannot do that any longer for emergency care. You have to provide the same benefits regardless of whether they're in-network providers or out-of-network providers. All of this goes to increasing premiums. Preventive care without cost sharing. All of the preventive care benefits that you receive, in which in the past you may have been required to pay a co-payment for or something like that, or been subject to a co-insurance or a deductible, you cannot have that any longer. Okay, it's been eliminated for all preventive care. Women's preventive care and contraception is the same thing. Internal and external appeals procedures. These are additional appeals procedures whenever you have a denied claim that the employees are going to be entitled to access, and it's going to require at some point in time, if their claim continues to be denied, going to an outside determination board, and that's going to cause an increase in some expenses due to the need to contract with this appeals board. Summary of benefits and coverage. I think most of you are probably familiar with that. That's just simply a summary, kind of giving the basics of every plan that an employee has an option of electing. Okay, if you only have one plan, you only have one summary benefits and coverage. But if you have multiple plans, you might have multiple SBCs that you have to provide to all of your employees. For those of you that insured plans, the good news is that most of the insurance companies are providing the SBCs and distributing. If you have a self-funded plan, you need to talk with your administrator or make sure that you yourself are distributing SBCs, because there are some significant penalties for failure to distribute SBCs to your employees. Reporting the value of 2012 coverage on 2013 W-2s. this is that requirement that you have to show on the W-2s the value of coverage that you provided for your employees. I think most of you who already are aware of that. The question there has become, what do you have to include on that? And the answer is pretty much everything that has any value as far as health coverage. So they say that the reason for this is to simply inform your employees what you're providing for them. But I personally think that the reason for this is that at some point in the future, the government's going to come in and want to tax that coverage. Okay? And that's the reason that they're kind of getting everybody used to putting it on their W-2s.
Dave?
Yes?
For 250 employees or more?
Oh, yes. That's right.
Well, 250 reported W-2s.
Right. Okay. And I think we probably touch on that, but later. But
Okay.
yeah, Dina and Callie clarify that this only applies to those employers who last year issued 250 or more W-2s. So it's going to eliminate this requirement for a lot of you.
It may change.
Yeah, it may change. And that's the thing about anything I'm talking about today may change, and it may change tomorrow, or it may change 15 minutes after we walk out of this room, because that's the way things have been pretty much going on. Well, let's see. State exchanges and low-income employee tax credits, we're going to talk about that. The individual mandate and penalty, we're going to talk about that. Wellness reward maximum increases to 30% of premium. This says that if you have a wellness plan in which you may award employees a lower contribution rate for satisfying the wellness plan, which could be something as simple as getting their blood pressure checked, or having any of the biometric testing, or it could require them to stop smoking or lose weight or improve their BMI, anything like that. That right now the maximum reward is 30% of premium, the premium cost, which is pretty generous. And the interesting thing about this is the government is focusing in on tobacco. And they're saying that in 2014, that's going to go up to 50% if the wellness criteria is related to the use of tobacco. So that's something that you can keep in mind. You can charge your employees more to participate in the plan if they use tobacco, and that would be permitted. Large employer shared responsibility penalties, we're going to talk about that. The mandate reporting, we're going to talk about that. The prohibition of annual limits, we've already talked about, and then cost-sharing limits. The cost-sharing limits is something that we're going to talk about, and is one of those other items that has been pointed out by the insurance companies as being a major factor in increasing premiums to you. Okay, so that seems to be kind of my theme of what we're talking about now. Effective in 2018, a 40% excise tax on Cadillac health plans. Okay. Are you a large or are you a small employer? Well, we have all of these different requirements under the Affordable Care Act. So let's take a look at some of these. Small employer premium tax credit. This is that benefit paid to small employers that say, if you contribute to health coverage for your employees, we're going to give you a premium tax credit. Okay, it's a sliding credit. We'll talk about it in just a moment. But what the criteria for receiving this tax credit is that if you are a large employer, that is, you have 25 or more full-time employees, you're ineligible to receive this particular tax credit. So it's 25 employees. Small employer is someone who has fewer than 25 full-time equivalent employees, and by the meaning of full-time equivalent employees, this could mean if you have 2 part-time employees that if you combine their work hours, they work out to 1 full-time employee, then that is 1 full-time equivalent employee. Okay. Their average wages must be less than $50,000, and the employer must pay at least 1/2 of their premiums. If the employer does all these things, they're going to be entitled to a premium tax credit, at least for the time being. Next is a self-reportable excise tax for compliance violations. Under the Affordable Care Act, employers are now required to self-report and pay an excise tax anytime any of you fail to comply with COBRA or HIPAA, GINA, any of those many laws sitting out there that have penalties. For instance, if you fail to offer COBRA to any of your employees who are entitled to COBRA, you are going to be hit with an excise tax that you don't have to wait for the IRS to come audit you. You must self-report it, and you must self-pay it. there are some exceptions to that that we're going to go over. A large employer is one that has 51 or more employees. A small employer is one that has at least 2 but not more than 50 employees on business days during the preceding calendar year, and at least 2 employees on the first day of the current plan year. Okay? That's one of the simple rules. Isn't that terrible? So, the reason I put this here is that if you are a small employer, you're exempt from this requirement that you self-report your compliance failures, and you are not going to be subject to the excise tax. But the government has said, okay, but for small employers who don't offer COBRA when they're supposed to, or they do violate HIPAA or GINA or any of these other laws that are sitting out there, we're going to find some way to penalize you. Okay, so you can't sit back and just rely on the fact that you're a small employer for this purpose. That's going to be a significant problem. W-2 reporting of aggregate costs of employer-sponsored health coverage, that's the one we already talked about. Large employer shared responsibility penalty. This is the big one that's sitting out there and that has everybody scared. This is the law that says that if you do not provide coverage for your full-time employees, or if you do provide coverage for your full-time employees, but there are some full-time employees who do not receive coverage or it's not affordable to them, then you are going to be subject to a penalty. The criteria for this is a large employer is one that has 50 employees, including full-time equivalent employees. We'll talk about that in a second, but basically what that says is you can have 25 full-time employees, and if you have 50 part-time employees that together equal 25 employees, full-time employees, then you're going to have 50 employees, you're going to be a large employer. A small employer is exempt. A small employer is one that has fewer than 50 employees. Employee count must include part-time and seasonal employees. Now, I added that in because Dina was telling me that some of you have been already having questions regarding some of these issues regarding seasonal, part-time, temporary employees, and we're going to talk about that in just a moment. Offering coverage to employees through an exchange. Who's eligible to offer coverage to employees through one of the state exchanges that's being put into place for 2014? A large employer may do it in 2017 at the earliest. In other words, until 2017, a large employer cannot buy coverage through the exchange for their employees. And a large employer is 101 or more employees on business days in the preceding calendar year, and at least 1 employee on the first day of the plan year. These rules are unbelievably convoluted, aren't they? Don't try to remember them. Remember, I was saying that. You're not going to remember this stuff, but I do prepare pretty detailed handouts so that you can go back and take a look at it and get an idea of at least what's going on. A small employer for this requirement is one that has 100 and fewer employees on business days in the preceding calendar year. And the states may limit participation in the state exchanges to under 50 employees until 2016, and that's what Oregon has chosen to do. And we'll be talking about that in a moment. Automatic enrollment and renewal for large employers, subject to the Fair Labor Standards Act. A large employer is going to be subject to this requirement whenever it comes into play, and we don't know when that's going to be. A large employer is one that has more than 200 full-time employees. A small employer is going to be exempt from this automatic enrollment of employees requirement, and that is an employer that has 200 and fewer employees. So we really needed to talk about, are you a large employer, are you a small employer? But that being the case, we're going to get into talking about some of the large employer shared responsibility penalty provisions that probably are just going to astound you because they are so complicated, but we really need to go through it. And I just want to keep warning you about that because it's going to be awful. Okay? You're not going to like what you hear.